So thank you very much to the organisers for giving me the opportunity to be here. My talk is entitled Building a Stage for Others, and rest assured I do appreciate the irony that I'm standing up here on my own, literally on a stage, talking about building a stage for others, but I get that. So let's talk about someone else for a moment. Salome Karwa was a nurse in Liberia in 2014 during the Ebola outbreak there. She contracted Ebola, but was one of the few that survived. However, she lost both of her parents, her brother, and numerous members of her extended family. With the immunity conferred upon her from having survived Ebola, she returned to her work as a nurse, working with Ebola patients, offering them comfort and care, but also hope that this potentially was a survivable disease. For her work, she was on the front cover of Time magazine. She was named, herself and colleagues working with Ebola were named Time magazine Person of the Year. So quite literally front page news. Less well known is how she died a couple of years later from complications after a cesarean section, which should be a relatively routine operation. In sub-Saharan Africa, the mortality rate after C-section is 50 times higher than it is in Europe and North America. Lack of access to safe surgical care is a silent killer. It's a day-to-day, everyday killer. I work in the Institute of Global Surgery in the Royal College of Surgeons in Ireland, and these are some of the problems that we're trying to address. We work in partnership with, mostly with surgical training organizations in low resource settings to produce the workforce to take care of people like Salome when they need care. Lack of access to surgical care, it's a big problem. Most of the world, an estimated 5 billion people, do not have access to safe surgical care that they can afford when they need it. 1/3 of all mortality, 1/3 of deaths in the world, 17 million people a year, those deaths can be treated by a surgeon or with surgical care. We need 143 million additional procedures, surgical procedures every year. The statistics go on and on. A major part of the problem, probably the key part of the problem, is the lack of a trained workforce to take care of these people. A trained workforce is a surgeon or a surgical provider, an anaesthetist, the peri-operative nurses in the operating room, obstetricians. It's a whole team. It's not one person. It is a team. Now, what was I going to say next? So we partner with institutions in low resource settings, and our longest running partnership has been with the College of Surgeons of East Central and Southern Africa, known as COSEXA for short. We've been working with them for 16 years now, and we're very grateful to Irish Aid for funding to allow us to do so. When we started working with them, they had 40 surgical trainees across a couple of countries in East Africa. Now it's well over 1,000 surgical trainees across 20 countries in sub-Saharan Africa. And the organization has changed beyond all recognition. It's a professional organization with high quality programs all across sub-Saharan Africa. That's been fantastic. It's been a pleasure to see. It's been a pleasure to be involved in that, and it's a pleasure to hopefully have played some tiny part in that growth. However, and I think I'm speaking to an audience of, like myself, mostly global health professionals. Some days I wonder, what part did what part did my organization, what part did high-income country organizations play at all in that success? Perhaps it would have happened without us. Some days, mainly Monday mornings, I kind of go, are we getting in the way? Are we, as international partners, just another layer of bureaucracy, just another challenge for our low-income country partners to deal with? Maybe sometimes we are. The benefit of looking back over a long-term partnership is that you can look back and see what worked and what didn't work. Over 16 years, we've done an awful lot of things together. We worked together on everything from finance to administration, to marketing, to designing curricula, to running training programs, examinations, electronic logbooks, you name it, everything involved in running a surgical training college we have partnered on. And if we look back, definitely there's been plenty of failures, but there have been successes too, and trying to kind of draw out the common threads for what worked and what didn't. What I see is that it is the way in which the two partners have worked together on specific projects that has made the difference between success and failure. Not the subject of the project, but the way the partners have worked together. In some cases, RCSI has essentially provided funding for COSEXA to run a project, and in many cases, those have worked well. In other cases, RCSI, my institution, has very much run with the project ourselves. And again, moderate success. In other cases, again, both partners have worked side by side together on a project with maybe co-leads, a bit, like the co-moderation we've seen so successfully demonstrated today. That is better, I think, but I don't think it's ideal either. You have that whole issue of attribution. Who is actually in charge? If there's a high-income country partner lead and a low-income country partner lead, whose fault is it when things go wrong? Whose number should you call? It's a little bit inefficient, and it can be frustrating. I mean, if people feel someone else is doing their job, there can be issues there. I think the work that we've worked on that has been most successful has been where RCSI, where the high-income country institution with resources, with expertise, with experience, has created the stage to allow the low resource setting partner to run the show. Let me give you an example to hopefully illustrate that fairly abstract idea. Back in 2010, we worked with COSEXA to build an e-learning platform. It was quite straightforward. An e-learning platform that all surgical trainees in the region would go through, take courses to accompany their surgical training. With COSEXA, we built a number of courses. We built some of the courses ourselves. Other international partners contributed. Over time, more and more surgical trainees were enrolled in this platform, and they got used to using it. It just became part of the everyday of what they did in their surgical training. As it got bigger, people started to approach us and say, I've got an idea. Can we do this? Could we try that? And our answer was, well, I never thought of that, but okay, let's see what we can do. A group of surgeons from Kenya approached us and said, look, we want to build a program, an online training program that accompanies surgeons every day for the first 2 years of their surgical training. Sounds great. Yeah, that's a big idea. That's a lot of work. You sure? Okay, go ahead. And we had very little to do with it. They essentially created that program themselves over a number of years, quite a number of different surgeons, and now it is hugely successful. There's about 500 surgical trainees enrolled in that program at the moment, going through all across sub-Saharan Africa. Brilliant. We did not create the course. We didn't have the idea for the course. Nothing to do with the course was really about us. What did we do? Well, we created the platform. We created the community. We brought people together and allowed that was the environment that allowed that to happen. Fast forward a few years. We've been working with the United Nations Institute for Training and Research and the Global Surgery Foundation, and earlier this year, a few months ago, we launched the United Nations Global Surgery Learning Hub. surgehub.org. On your lunch break, please go have a look at the website or download it from Apple or Amazon, or not Amazon, Android, I should say. Let's plug over. SurgeHub. So this is intended to be a repository of surgical training information for low resource settings, taken from all over the world, from high quality sources all over the world. We have Médecins Sans Frontières, we have Stanford University, McGill University, the Royal College of Surgeons in Ireland, NGOs like Lifebox, Smile Train, the big hitters, many of the big hitters in global health and global surgery from across the world. The most popular course, the most used course on the United Nations Global Surgery Learning Hub is COSEXA's Surgical Foundations course. Again, this platform's only up a couple of months and it's kind of rolling out quite slowly, but we already have 750 surgical trainees from all around the world completing the course. On average already, they've spent 25 hours each on the course, given that some of them have signed up last week. That's, it's quite a lot. It's about 20,000 hours of people spending time on this platform already. To repeat, we did nothing for this course other than give it a platform. To kind of labor the theatre analogy, first we built the theatre and a ticketing system and maybe some advertising for the theatre. COSEXA put on the play. It was wildly successful. Next, we started a production company, and now the Surgical Foundations course is on a worldwide tour, and it's doing amazingly. And I'm really proud to have had a tiny, tiny part in that. Retrospectively, we see that there's literature that supports this way of working and that it's particularly effective in the field of global health. There's a very good piece called The Power of Letting Go in the Stanford Social Innovation Review, so I'd encourage you to maybe Google that if you have time. It's very simple. Create the platform, create the opportunity, and very importantly, step back. Let go. It's your baby. Let it go. Someone else's to do what they wish. So, at a professional level, I think that's an idea maybe some of us can apply in our own work. At a personal level, when we're having the bad days and we think, look, maybe we're not really making a difference in the world that we'd hoped, maybe that can give a bit of solace. But most importantly, people like Salome Karwa in the future, hopefully, thanks to our partners' work supported by us and many, many others, hopefully they will have surgical care when they need it, and not so many lives will be lost in the future. Thank you very much.